All right, welcome back to Sacramento and Company. There's downtown. So, Kristen, it's been exactly 1 week since you've had your LASIK surgery. How are you feeling?
Yes, I'm feeling great.
How many fingers am I holding up?
Oh, you're funny. You know how many times people have said that to me this week?
Really? Oh,
yeah.
okay.
Getting
so
old.
it's not a new joke.
No, it's not at all.
So don't do it
The cool
again.
thing is I can see when I wake up in the morning, when I go to bed at night. I wouldn't be able to tell you how many fingers you had up if it was
Really?
the middle of the night. Yeah.
Wow.
That's the most exciting thing, I think.
She can see.
Yeah, I can see. And we have Dr. Leonard Newman and Jason Hazelhune from Newman Lasik with us today. These are the men responsible for
Miracle workers.
my vision. Thanks so much, guys. It was really a great experience.
Super.
You have just a great staff from the minute I walked in the door. In fact, I went with a girlfriend and we walked in and they said, "Hey, how are you? Hi, welcome." And we're like, "Hi, how are you?" And they said,
Right.
"And what's your name?" Like they're just that friendly to everybody.
Now, she didn't try and bolt this time because we know that she bolted last time after her first visit there.
Well, you all were holding me accountable. I had too many people that knew I was getting
know,
this
you,
done,
you
so I
had
couldn't.
to come.
The
you
pressure.
had to follow through.
Yeah, it was great.
So
And-
how was she as a patient?
Kristen was great. I think she was ready for it. She wanted to get out of those contacts. And Kristen, you're right. You were blind without that correction.
Really?
You really, yeah. You were up there about a -5, -6, which really translates into vision here, and that's about it. And so your procedure was about a minute and a half. It may have seemed a little quicker to you.
That's it?
You seemed to just float right through there.
That's
my
it.
gosh,
a
it
minute
seemed like-
for both eyes.
A minute and a half.
Each.
A minute and a half. Yeah. Yeah.
Wow.
And I know
That's
your mom
amazing.
was really impressed there. She watched the whole thing.
My mom was great. And she thought it
quite
was
a few
really
pictures.
interesting that you guys could show her what was going on during the procedure. She was watching, I guess, from some kind of monitor or something.
Yeah. She had the surgeon's view there. With you can see with the camera on the laser. But I think that emphasizes, our biggest goal, the surgery. Pretty simple for us. I've done 30,000 of these, and after you go through your evaluation there, and we study your eyes from front to back, and we know you're a good candidate, we can deliver that treatment. And I think the biggest and most important thing is just to make people comfortable.
Yeah.
And our staffs work together for years and years, and we really like what we do, and I think that that really translates into the excellent results we get. Each step of the way is very, very important, from the beginning scans to looking at the eyes there, and then actually delivering that treatment. I mean, you do your best when you're comfortable, and that's something I think we're very, very good at. Patients often compliment the office on how easy it was and how long they had thought about it prior, and that's super. I'm excited for you, Kristen. That's a big change for you, and it
Thank you.
makes us very happy.
The funny thing is, I had thought about it for years, and as you
Yeah.
know, I went in for a consultation earlier this year and then chickened out, and it's just something I've always wanted to do. And for thinking about it for years, it took a minute and a half each eye, and then it was done, and that was it. But it was a great experience. Everybody was wonderful. It started off, and I think we have some pictures of this, but with Jason kind of giving me an overview of what was going to happen, and here are some things you may feel. Oh, there it is, and
Glamour
that's
girl.
it's in the surgical shower cap.
Good photographer.
Yeah, there's Jason filling me in on what all the eye drops are, and I'm listening intently. I think I had already taken
Was she
going
going to take a shower? Was that why she had the shower cap on?
You get one in, one ear, out the other.
And that is,
Very stylish.
I was going to point out the dog. What was Patch?
Little Patch.
Patch. There's Patch on
there's
my
Patch.
chest. And it was so
Mandatory.
great because one of you had said, "Don't hit me, don't grab the machines, grab Patch." And that poor dog, I think I mutilated doing it. I was
Very
so nervous.
resilient. Kristen taking a little nap afterwards.
So one thing that I wasn't aware of was some of the things that you could feel right
Wow.
after the surgery, just the stinging of your eyes
Sometimes
and
they're a
watering.
little stinging.
Tell us what some of the things that people deal with right after the surgery are.
Yeah, generally the eyes are quite comfortable as you leave the office, and usually people sort of equate it to sort of a dirty contact lens feel. Sort of a stingy, sort of mild discomfort, and generally that lasts for about 2 to 3 hours. Sort of half our patients are a little uncomfortable like that, and the other half they feel nothing at all, and I think it just reflects the sort of variability in how people heal and how sensitive their eyes are. But usually by that evening, like yourself, they're watching a little TV or helping their kids with their homework or sort of back in action, and then the next day is where you see that big change where almost everybody returns to work and they're back to their daily routine. In fact, you went running on Sunday.
I did, yeah.
She
I
came back to work the very next day.
Yeah.
I went to work the next morning. I worked out that afternoon, and I ran the Apple Hill Fun Run that weekend.
Super.
In fact, somebody out there said, "Hey, can you do that after having eye surgery?"
Yeah,
Well, according to my doctor, I can. I hope so.
Now, Jason, what about like follow-up after this?
Well, we'll see. We'll probably see Kristen at least 3 more times.
Right.
Just a standard of care. We see her the very next day, and that's kind of like the celebration day. That's when everybody's wowed by the procedure, and you find out if you're 20/20 or even beyond that, which Kristen is, by the way.
I was 2010. Yeah.
Yeah, it's a
Rock
great
and roll.
That's so exciting.
Yeah, so standard of care, we're going to see at least 4 times after the surgery, and obviously if you feel like you need to be seen before that, we'll see it. But other than that, it's a piece of cake.
Yeah. So finally, tell us how Dr. Newman's bedside manner was.
Oh, he was great. He made me feel so comfortable and just talking the whole time, which is good because, it's not a horrible sound, but you do hear the machines.
Yeah,
so to hear somebody saying, this is normal, you're doing well, you're going to be seeing clearly soon, helped a lot.
Yeah. All right.
Yeah.
Excellent.
Thanks, guys.
I was in good hands.
Great vision.
Thank you so much. And I will see you Tuesday for that follow-up appointment.
Right on.
She will show up for that.
I will. A special thank you to Newman Lasik for sponsoring this segment of Sacramento and Company.